temperamental traits that are on the difficult to raise side. There sometimes is a mismatch between parents' style of parenting and that set of temperamental traits that gets to the point where the parent and the child are very much at loggerheads, and you get what's sometimes referred to, as a strong-willed kid who is really by temperament. And for the most part, for oppositional defiant disorder, the treatment is helping the parent find a parenting style that is a better match for the child's temperament, and instituting some behavior mod program, and also coaching the child on how to get along better with those in authority.
To fast track from the place of parents who are dealing with children and teens that are in trouble, even though they don't have a diagnosis yet, whether they have ADHD, wouldn't you say, doctor, that it would be smarter to get whatever tests are taken biologically first, and then to make sure that, for example, did you say neuroepinephrine?
Well, yeah, there's norepinephrine, and the primary neurotransmitter is dopamine.
Right, and dopamine. Can you tell the public what they should be going to the psychologist or the psychiatrist for those tests? I would say a lot of psychiatrists wouldn't necessarily know what test to order for ADHD. Do you agree with that?
Well, I think their child psychiatrists would know that, and certainly child psychologists would know that. Unfortunately, there's some people that are out there who may only have a master's degree, and sometimes people think they are psychologists when they're not. And so you need to be very clear about the credentials of who you're seeing. In some medical groups, particularly like Kaiser, often they're referred to developmental pediatrician who are very good at making these kinds of diagnoses. So I think, developmental pediatrician, child psychologist, or a child psychiatrist have the training and experience to really rule out everything that needs to be ruled out, and also rule in perhaps conditions that may exist along with the ADHD, so that if the diagnosis is made, the treatment program that is followed is comprehensive.
That's what your whole package is about, the comprehensive approach to this condition. I like that you said in the book that you acknowledge that sugar plays a terrible role to accentuate the condition of ADHD that the person's experiencing. Why did you say that?
One of the things that we didn't add to my credentials, I suppose, is that my son was diagnosed fairly early at the age of 5 with ADHD. So we observed in him that sugar definitely was a factor in making his symptoms worse. I would say that there's definitely no research that says that sugar, quote, causes ADHD.
Right.
And there really isn't a lot of research that says that sugar makes it worse. However, those of us pediatricians, psychologists who have worked with these kids know better. And certainly there's nothing, not going to hurt the kid to cut out sugar. It helps the behavior. The same with the Feingold diet. I mean, I think that kids who probably respond to like a diet approach really are misdiagnosed. They probably have food allergies or food sensitivities that are causing these symptoms, but wouldn't have classic ADHD where they are born with a brain that is more prone to those symptoms.
Did your son ever get off medication?
Yeah. My son at 5 did go on medication, even though we had tried some behavior modification. And here's a kid whose dad is a child psychologist specializing in this, mom who taught 6th grade for 13 years, and you got a 5-year-old in your home that you can't handle. But when he was 14, he was able to come off the ADHD. He finished high school, graduated with honors from university without having to take any medication.
And so what did you test him for?
Well, the only thing that you can test for, it would be great if we had a biological test, if there was a brainwave test that would show for sure that this child has ADHD, or a PET scan, or a blood test that we could see what level of your dopamine is present in your brain. Unfortunately, none of those technologies yet exist. Even
in anti-aging science and medicine, which is all brain-driven, we don't have it?
No, the problem is there's this neat protective mechanism in the brain called the blood-brain barrier.
Yes.
It's there to keep bad things from getting into the brain, but it prevents us from knowing what's going on in the brain. Otherwise, you can draw blood and find out how your liver's functioning, your kidneys, your lungs, any other part of your heart. All those things we can look at through blood analysis, but unfortunately, we can't do that with the neurotransmitters in the brain. We do know from animal research and from like brain scans in a research mode that definitely there is a difference in how a person with ADHD's brain functions than a normal population, and we also know that when those who are on medication take their medication through these PET scan studies, we can see that their brain tends to function and look more like the normal population when they're on meds.
A lot of kids say they hate the way they feel on these meds. Why do they say that?
Most of the time, if they're on a med that they tolerate well, they probably won't know that they're on it, and they may just feel calmer, if anything. And a good example is I had a kid one time, he was about 14. And let me say this, I try to help every kid I can not take meds, okay? But there are some that need them. So this, I think he was like 13 or 14-year-old kid who was having a lot of trouble in school and at home, and we tested him. And the tests that we use are to measure, like, they're neuropsych tests that measure brain functioning. And they're usually done on a computer. There's several versions of it. They're called CPT tests. So those are good. I also sometimes use I use a test that measures auditory attention as well as visual. And then you rule out the learning disabilities, and of course you have parents and teachers fill out questionnaires, and their rating of the child is compared with a statistical base to see if where they rank as far as severity of those symptoms. But with this kid, we decided he did need meds. The pediatrician put him on medication, and he came back, and I go, so, dude, how are you feeling? And he goes, I feel the same. I don't feel any different. These things aren't doing anything. And so I said, well, have you noticed any change at all? He goes, oh, well, kids aren't teasing or picking on me. The teacher seems nicer, and my parents aren't on my case all the time.
That's interesting.
Oh, his world changed, but he hadn't changed at all.
How do patients, people afflicted with ADHD, get off the medication and still have normal functioning? I don't get that part. I wonder if you could illuminate that to the public as well.
Well, what we think happens is that in some cases, as a child develops, some of them catch up with that. There are there's a big longitudinal study that was done and is still going on by NIMH using brain scans comparing ADHD kids with normal kids. And what they've found